generally speaking, management of diabetes, and that's both types, is also mishandled, I think, by physicians, by diabetes specialists, because type 1s are told, okay, well, so you are taking insulin injections, or if you're lucky enough to have a pump, okay, so you have an insulin pump, so you can eat whatever you want and just cover it with insulin. That is not, in my opinion, I've done it, and it didn't help make me a healthier person. And type 2 diabetics are quite often told, well, again, you're on medication, so you can just eat what you want and just take your medications. So, and it is a chronic disease. It's going to get worse eventually, but that's your luck. So how do you handle? I mean, what do you do? How do you treat your? How do you tell them about the lifestyle intervention? Because that's not what every diabetes specialist is doing.
So you're absolutely right, and I put my hand up. I'm guilty. For many years, we were taught, and I was told, that because of the fantastic insulins that we've got now, if you have type 1 diabetes, you can eat whatever you like as long as you give the right amount of insulin. And this particularly came about when the rapid acting analogs first came around. The first one was Humalog. I think that was about 25 years ago. And there are now a number of them, but the drug companies produce all these data which showed it's absorbed very, very quickly. It can bring the blood sugar level down very quickly. You inject it just before you eat, and it doesn't matter what you eat, you just need to give the right amount of insulin. So in theory, that's great. And we would teach that, and I teach that to patients in the education courses and management courses that we ran for people with type 1 diabetes. But it didn't always work. And if you actually stop and think about it, it's pretty obvious that it's not going to work. So thankfully, my pancreas, as far as I'm aware, still works well and normally. So if I eat something, then as soon as my pancreas is able to sense that my blood sugar level is beginning to rise, it will start producing insulin. And it releases that insulin directly into the blood vessel where the glucose is coming from my gut. Okay, and this is a marvelous closed loop system, okay, that works and keeps my glucose levels nice and stable. Or so we thought. Now that people are beginning to use glucose monitors just to try things out, even people without diabetes, we're recognizing that if you have a very high sugar, some food or drink with a lot of sugar in, even if you don't have diabetes, your sugar level can go really quite high. Okay, but you know, I can pretty much get away with it because everything works normally. The difference in type 1 diabetes is that, one, you're not injecting the insulin directly into the vein where the food is coming in. You have to inject it through the skin or infuse via pump through the skin. So it's then got to get through the fat cells in the skin. It's got to be absorbed into the bloodstream, and then it's going to get up to a level within the bloodstream so that it can begin to reduce the blood sugar level. Okay. So that's in terms of how it gets there. Second, the timing. We were told at one point, you know, these insulins are so great, you can actually inject eaten and they'll work back in time. Well, of course, that's complete nonsense. Because within 15 minutes of eating, your blood sugar level's already going up quite high. If you then inject, then by the time that insulin is from the sugar, the level's gone really high. And so this idea that it works immediately is just not true. So there's the timing, there's the route, but then there's also the amount of insulin. So traditionally, people are taught to count their carbohydrates and inject the insulin according to an insulin to carbohydrate ratio. So it might be 1 to 10. So for every 10 grams of carbohydrate, you inject 1 unit of insulin. It's a good starting point for anyone who wishes to use that approach because it makes the maths more straightforward. But how do you know how many carbs you're eating? It is always only going to be an estimate, because no one knows exactly. And then we've got to think, well, not all carbs act the same. Some are absorbed into the gut really quickly and push the blood sugar level up really quickly. So if you were to eat sugar or drink a can of soda, it would go up really quickly. Others, it's much more slowly. So a bowl of pasta, anyone with type 1 diabetes will know a bowl of pasta, your levels might not go up for some time, but then they go up and they go up and they keep going up for several hours. There is no insulin available that is going to manage that, unless you have a pump and you have a prolonged or square wave bolus. But then there are things like some white bread or white rice, which is a starch, so it's not sugar, but it's broken down so quickly into sugar that it acts very much like a sugar. And so it's not even a question of versus starch. Is it sugars versus some starches and other starches that act differently? And to carry all of that information in your head and to be able to give exactly the right amount of insulin at the right rate at the right time, I think is just impossible. So that's why I started to say to people, look, we've got the best insulins we've ever had. We've actually, even with the technology, and especially with the technology that we've got now, even something like a Freestyle Libre, which shows what's happening to your blood sugar levels, you're giving what we think is the right amount of insulin, but your sugar level's still going up. So I don't think that works. I don't think that's right. And I no longer say to people with type 1 diabetes, eat what you like, because what I say is, by all means, you can eat what you like. In theory, if you give the right amount of insulin, it will work. But in practice, it's difficult to achieve that. And so you might like to try experimenting by having some meals which have got a lot less carbohydrate in, and just see if that helps you manage your levels better.
I have to reiterate what you said. I've done just that. I've tried to be very clever and smart with my pump and use the square bolus option, or that's basically spreading the insulin over 8 hours, 6 hours, 4 hours. So you're not taking just one big bolus of insulin, you're spreading it. I've tried to be so clever with it. But no matter what I tried, A, didn't work, and B, if it did work, by chance, one day, it did not work the next day. So so type 1 diabetes and matching your insulin intake to your carb intake is just far too complex an issue, because there are too many other variables as well. So
just before, I think that just to follow on from what you were saying about how from one to the other, eating the same thing can have a very different effect. What we haven't even begun to talk in terms of insulin dosing is how the time of day affects insulin you need, how stressed you are, whether you're unwell, if you're a lady, what stage you are in your menstrual cycle. So I think that's a really good point to then say, well, okay, wouldn't it make sense to make it easier for you, for your body, the amount of carbohydrate you eat? Because by definition, if you have type 1 diabetes, your body cannot tolerate carbohydrates, okay? There are a number of other food diseases. There is celiac disease, which is gluten intolerance. People and people with celiac disease, they are told, not even advised, they are told you need to avoid all foods that contain gluten. And you have to be really strict. You need to be very careful. Some people are even advised you need to use different plate knives and forks other people in your house in case there are traces of gluten left on their implements. If you have this intolerance, which is an intolerance to the sugar that's in milk, you are advised to avoid dairy products that contain lactose. So it seems to make sense. If you have carbohydrate intolerance, and type 1 diabetes is a form of carbohydrate intolerance, you need to avoid carbohydrates. Okay, so what does that mean? Well, that means what you can eat anything else that doesn't have sugar, or that doesn't have highly refined carbohydrates. Now, a lot of foods will have a low carbohydrate in them. Even leafy green vegetables will have some non-starchy carbohydrates. You can't avoid all carbohydrates, but you can make it much easier for yourself to avoid sugars and to avoid starchy foods or large portions of starchy foods.